Good evening, everybody. No, it is good evening. My topic for today is DCR failed, nothing to worry, no financial disclosure. The impact of failed surgery on surgeons, often referred to as the second victim, is profound, and they experiences all type of significant consequences. As published in various journals, success rate of external DCR is 85 to 98%. Despite excellent success rate, there are a large number of cases with failed typically due to all these causes. And to overcome the problem, we conceptualized a small flap saving technique of repeat surgery, which is easy to perform with successful result and a short learning curve. And the aim of this study is to evaluate the success rate of repeat DCR using a small flap saving technique, which is a prospective interventional uncontrolled study with 134 patients from March 2011 to August 2023, all performed by a single surgeon to reduce outcome bias. And the inclusion criteria is row plus after at least 6 months of the primary procedure. And the changes with made the use of Arugaj bone refined to make osteotomy. Approximately 1 mm to 2 mm of the lacrimal sac was preserved around the common internal opening of the lacrimal sac, maintaining a disc shape with a central punctum that resembles a funnel. And this adaptation was necessary because obtaining sufficient flap for mucosal anastomosis is often challenging, and as a result, the technically difficult flap creation and suturing of the posterior flap have been omitted in this modified procedure, and the upper portion of the preserved flap was sutured to the subcutaneous tissue or the periosteum on the medial side, and the skin was closed. On the 5th post-operative day, 1 ml of 0.4 milligram mitomycin she was administered in the newly formed passage, that is syringed in the newly formed passage, and these all cases were followed up for 1 year. Oh, sorry, and it is not, video is not running. All the cases were now we come to outcome assessment. These all cases followed up on 5th day, 1 month, 3 months, 6 months, and 1 year post operatively. At each visit, the surgical outcome was assessed anatomically and functionally, and the result of 134 patients operated over 12 years is 131 were successful at the end of mean follow up period, that is 12 months. 2 were complaint of Roplas and EP4A despite successful syringing, and 1 patient failed in syringing. And now we come to the statistical analysis. For the comparison of this study with previously published studies, meta-analysis were performed using MedCalc software, and the Cochrane chi-square test and inconsistency were used to assess the heterogeneity among the studies, and p-value less than 0.05 was considered to indicate the presence of heterogeneity, while inconsistency more than 50% was considered to indicate acceptable heterogeneity. Proportion were reported with 95% CI, and this is the comparison of success rate with published studies as yet, and this is meta-analysis of success rate reported in identified studies on failed DCR. And this is the forest plot study, and the forest plot depicts that the study by Wu et al. Can be the source of heterogeneity, and the symmetrical funnel plot suggests absence of bias, and the meta-analysis of success rate showed significant heterogeneity, that is 87.48%, and the 95% CI is lower bound 76.52 to 93.33%, and p-value is less than 0.0001%, one between the reported studies. And one question, why mitomycin syringing on 5th post-operative day? We used 1 ml of 0.4 milligram mitomycin syringing on 5th post-operative day, so that the antifibrotic property of the mitomycin C is utilized maximally, as it is not diluted by bleeding from nasal mucosa, and better coincides to early proliferative phase of wound healing, which starts from 4 to 5 days of tissue injuries. That we come to, lastly we come to the conclusion that anatomical and objective success rate is 133, that is 99.2%, and functional success rate is 131, that is 97.7%, and the success rate of this study is significantly better than the previously published report despite large sample size. And we conclude and recommend this method because this method is easy to perform with reliable and successful results. And now the failed DCR can be done with confidence, hence we can say DCR failed, nothing to worry. And thanks to Mr. Javed from LBP Hyderabad, Dhiren and ENT surgeon, my friend, and Lokesh aesthetician. Thank you. Thanks for patience hearing. And these are my differences. Thank you.
Thank you, Dr. Ravi Ranjan. It was nicely statistically presentation. Very nice. Only thing is that you mentioned 1 year, after 1 year you were doing the nasal endoscopy. After 1 year.
Nee, we do indoor. Finally, our period is finishing at the 1 year mean follow-up period. At the 1 year, we all do nasal endoscopy to measure the finally osteum, nasal osteum. That was another study, but just I included it at the 1 year.
As because you are not mentioning, I am not asking about this presentation. What is the changes you have noticed? Because you are doing at 1 month, then after 6 months, then after 1 year.
If osteum changes maximum up to 3 to 4 months. After that, it is more or less aesthetics.
So after 6 months to 1 year, you don't find any changes.
Aesthetics that is 4 to 5 mm in my case.
So what is the longest follow-up you have had?
12 years.
Okay. I must congratulate you on the longer duration of surgery and a very well statistically presented data that is there. Although I don't know whether I'll be able to involve this technique in my practice. Not so sure about that.
I am doing it for more than 15 years. And now I have done more than 5,000 cases, primary and failed too. And lastly, I have presented I presented since 2005. First, I presented in AIOS2025. That was 3 years from the year, and then after that, just continuing, I'm doing that.
So, is the credit goes to mitomycin or your technique?
Actually, I have combined both, sir. Actually, separate method. I haven't. Actually, I have no courage without doing DCR without mitomycin C.
So, for all cases, even primary cases also, you will be doing it.
Yes, yes, sir.
So, what about the number of cases, the times of failure? How many of them are once failed, or is there any sub-analysis?
In primary cases, it is up to 97%.
No, in your failed cases, how many?
One case is failed out of 134 patient.
Okay. No.
He is asking that out of the cases you have operated, how many were failed DCRs?
Failed DCRs.
All are failed DCR. I have included 134 failed DCR.
So how many of them are single time failed, or twice failed, or thrice failed? Is there
Actually, inclusion criteria was ROPLAS after 6 months of primary surgery.
So only once it's failed. Okay, thank you. That was a nice presentation.
Thank you.